Dentist had some falls.
Yeah, I was just wheeling along, and all of a sudden I'd be on my face because I couldn't see the left side or this side of my
right side.
The right side of where I was standing.
PCP said you have a neurological issue going on. You can't see anything to
this
right.
side, this side,
in either eye. In either eye. It's not one eye, but both eyes. So
you'd think you'd notice that.
It's neurological. He recommended a CAT scan, but we couldn't get in to see anybody for like a week. And so our daughter, the nurse, said, no, we're not waiting that long. Go right to the emergency room. Dr. Wilson said it would have been
too late.
Inoperable
if
we had waited just 3 more days. The diagnosis, when we went to the hospital and they did a CAT scan, the diagnosis was a mass on the brain. What kind of mass, you can't tell until the surgeon gets it. Right after surgery, the doctor came out to speak to the family, myself, and that was the first time when we heard the name of the tumor, which was glioblastoma. And I asked her, how do you spell glioblastoma? I don't even know what that is. And she said, tell you what, right now, don't even look it up. You know, how much time do you have? Maybe a year, maybe 3 or 4 years tops with standard course of treatment. No course of treatment, it would be much less. Standard course of treatment is after surgery to go through 6 weeks of radiation followed by chemotherapy.
Which, that doesn't make you feel good.
So what we did do was go to research hospitals, 5 or 6 research hospitals with his MRI, and inquired if there was something that he could be party to, be part of a not standard course of treatment that's under experimentation. There's lots of different kinds of studies out there, but the one that we went with is nivolumab. It's a immunotherapy treatment. The immune system cannot see under normal circumstances the glioblastoma brain tumor and allows it to grow.
Not only glio, but lots of different cancers are that way.
But in particular glioblastoma. So what it does,
the worst,
this nivolumab, unmasks the brain tumor and allows your immune system to see it and start doing its natural job, which is to kill it. To kill it.
Just recently, my eyesight improved dramatically.
Well, he doesn't have the standard illness, sick to your stomach, hair falling out, or anything like that. Of course, how could you tell? He doesn't have any hair. But there is some still mental confusion. There is some loss of cognitive abilities. How much of that is the tumor or the drug, it's impossible to tell.
My hope is I am okay for long enough for my grandson to recognize me. When he is 2 now. And
you know what you told me?
What?
You said you wanted 10 years.
I did want 10 years, but I'm trying to be reasonable. But you know what? There is no limit. Nobody knows how this will do. So it could be 3, 4, 10 years. Who knows how it'll be.